hi everyone. Today we're gonna have another question, and today's question is, can posture alignment help with sciatica pain? And how does it address the root cause?
I think that's a popular issue to drive people to come to Activate Posture. And I think, unfortunately, it is popular for them coming to us because they have done a lot of other stuff that hasn't worked. And if you've ever had sciatic pain, it can be very painful, but also just annoying because it can, make you numb. It can give you tingles down your foot or down your whole leg. And it can just kind of destroy your life or take over your mindset for a while. So we definitely treat a lot of clients with sciatica.
It's one of the most common things in our Boston clinic that we help people with for sure. And yeah, it's certainly limiting and really does rob you of your not only mobility, but then, comfort, peace of mind, and activities that you might do. So, and it's interesting one too, because there can be, a few root causes, and it can be a different root cause per person. So like you were saying, Carrie, and a lot of our clientele come to see us with trying other things that have not worked. And it's just because it can depend on the person individually. It's not a routine, protocol based thing that we can apply to every sciatic case, but there are definitely a few common things that we will see with people that, we'll definitely go through today that do cause that compression of that sciatic nerve and lead to those symptoms you described. I think one of the big ones, if we just want to look at that, like that area regionally, because, we expand the whole body and look at all the factors that lead to it, but just, compensation. We talked about in our previous videos, if there are certain muscle groups that aren't activating or facilitating properly, then other muscles will be tasked to overcompensate to do the work in place of that dysfunctional muscle, which then leads to that overworking, then becoming irritated, inflamed, short, tight, and something that can certainly compress that sciatic nerve. So kind of a very common compensation pattern we'll see is if somebody's glute is under leverage or dysfunctional, that's your butt muscle. And then the piriformis and hamstring muscles that do work along with the glute will then start to overwork to help work around that glute function. The sciatic nerve runs through both areas. So if those muscles then overcompensate for too long, it will start to lead to nerve compression and that sciatic symptom. So for people we see with that mechanism, getting that glute muscle stronger will help the body stop wanting to overcompensate or overuse those piriformis and hamstring muscles and help decompress that sciatic nerve.
Yeah, I think that's it's a good point, and you're diving in, like you said, to the region, and I think it's important also to expand that back out, and whether you call it regional interdependence or whether you call it the interconnected body, it's important to know like how the asymmetry in the let's say thoracic and shoulder position can affect and influence the pelvic position, and therefore affect if it's a lumbar disc herniation that's causing the sciatica down the leg, or if it's the asymmetrical foot position, knee position, hip position that is then changing the pelvic position from underneath, and maybe it's a sciatica notch, and then the piriformis gets blamed, right? So it's there's different mechanisms of coming at that, and then if we're looking at the whole body rather than just at the site of the symptom, then how we define from a more whole body holistic perspective, how we define root cause can be different than if you go into a traditional symptom focused methodology or system where they go, oh yeah, so your herniated disc is causing this, so bad herniated disc, and we're just going to go after that, or we're just going to go after your back in and by itself, rather than saying like, okay, well, your lumbar is affected again by the imbalance that's in your upper body, or by the kyphosis that's there, and or by the pelvic position that's created because we have an imbalance of the anterior front line muscles of the body versus the back line, myofascial system, and how those are connected, or from right to left, how those asymmetries are. I think one of the big things with sciatica is, is it one side, which most people it is, versus two sides. And if it's one side, then you have to think right away, there's asymmetry here, rather than thinking of, okay, I just have like this random problem on one side. Well, those underlying asymmetries or imbalances between the right and left sides have probably been going on for a long time.
Yeah, to that point too, if it is a one-sided sciatic symptom, oftentimes we'll see that the root issue is actually coming from the opposite side. meaning that there's a muscle group that's not facilitating. So say it's right leg sciatic symptom, that there's a muscle group not facilitating on the left side of the body, that then triggers your body wanting to use the more functional side, not use that dysfunctional muscle group, overloads that right side, which then leads to, compression, either whether it be spinal, of the nerves as they come out the spine, the disc, that sciatic notch you referred to, Paul, where that sciatic nerve tunnels through the pelvis, or, that hip, piriformis, hamstring area, these regions that the sciatic nerve runs through. I know you see that a lot, carrying with your clients, right?
Yeah, I also want to go back to one of Paul's other points, though. It is very rarely can you make sciatic pain go away by fixing one area. Yes, we need to identify the root cause and find where that root cause is. But that, like, if it's your glute, if that's the root cause is one weak glute, that's not the only thing that you need to do. You don't only need to strengthen that glute. And I think that's why people get very frustrated. There's tons of videos on, like, stick a lacrosse ball on your piriformis, to get release. And it does feel better for a few minutes, for an hour, maybe for a day. But if you don't, after releasing that, then go back and tighten the glute or move the spine into the better position, it doesn't go away. So it's often a bunch of different things. You have to get your right shoulder back, activate that glute, and release the piriformis on the left. Like, it's usually a combination of things that you have to do. It's important to find the root cause, but then from there, you have to kind of follow the path of all the affected areas and go after all of those individually. That's when you have lasting relief.
That's right. Yeah, those affected areas being compensation, right? So like the body's way of working around that region. So if you just focus on that affected area, but the body's put in all these bypass mechanisms elsewhere, you can work that affected area, the glute, like you said, your body says, okay, you can do that all you want to, but I've built this bypass network in, so, I'm just gonna avoid it, and then it doesn't do any good for long-term lasting relief. Yeah.
Yeah, it's always interesting when people are like very symptomatic on one side, and we do exercises both on the left and right, like front and back. So for example, everybody knows, oh, do the figure 4 stretch and pull your knees to your like chest. And usually when we do the symptomatic, like affected side, people will be like, oh, that feels great. And then when we switch to the non-symptomatic side, they're like, wow, why is this side so much more tight? And it's one of those things where they're so fixated on the symptomatic side, they don't realize that, hey, it could actually be the non-symptomatic side that is just, again, like Carrie Ann was saying, being bypassed and finding these other ways to work around.
Yeah, and nobody did anything with that. You're the first person who's done anything with that side. Like, why hasn't anybody else told me this?
It's a thing we get a lot with sciatic clients. Yeah, certainly frustrating, that it, like Carrie said, and Kim, it needs to be a comprehensive view, and just doesn't always, the case when people are looking and seeking help for sciatica. And even too, like, we work with a lot of clients and they have images like MRIs, right, or X-rays that show disc compression or a spondylolisthesis or herniated discs, bulging discs, stenosis, right, and all those things certainly are happening. We have photo proof of it, happening, but then we have to ask, like we're talking about, well, why is that happening? That's not something that just happens. It's not because you're old or because you're, any of these things. It's just over time. There's been all these areas of the body that have put compression or tension on the spine that lead to disc herniation, bulging, stenosis, and as that builds, it gets to the degree of compression that then causes, sciatic symptoms. So even if you have images that, that show that this is happening, it doesn't mean that you're stuck or you're broken or you need surgery or anything like that. It's stuff we can certainly help fix. It's again, just finding the root cause of even why that is happening in the first place.
When I do find it happening often with people who are sitting down a lot and they start to get kind of locked up, that can certainly circle back to things like weak glutes or lack of lumbar extension, things like that, that are all going to relate to muscles and muscle groups that can certainly impinge that sciatic nerve, which is most likely why there was an increase during COVID, because what were we all doing during that time? Kind of just sitting around. But that doesn't mean that it can't happen to somebody who's very active either. Again, it goes back to those compensation patterns that we were talking about. So you can be very active, but still dysfunctional. And that's still going to lead to it, just like we've all been talking about. That's why when I'm explaining things, which we've already talked about, I tell clients, like, your body's a big puzzle. And if those pieces are not fitting together, then nothing's going to happen, or it's going to keep happening. The pain's going to keep happening. No change will happen.
It's a great point you make, the active population, right? Because it's a large, majority of people we do see with sciatica are very active, runners and cyclists, Pilates, yoga. And yeah, it's just using an improper body mechanism, right? Parts aren't moving as they need to, muscles aren't facilitating over time. Even if you're active, it doesn't mean that, everything is in working order. That's an assumption that, we kind of make generally, but not the case, and your body will certainly let you know if it's not, with symptoms like sciatica.
Yeah, and some of the symptoms that come along with that, like people a lot of times have knee pain, or they have some SI joint pain, or they have some, some other like one-sided thing that kind of was a precursor, a warning, that kind of goes on and off with this, or some previous injury. So yeah, so then when they're active, like you're saying, then they're overloading that same side, or continue to work out of alignment. And then the usual thing is like, oh, you're weak, or oh, you're too tight. And so they, stretch, or they work out, and they seemingly do the right things, but the missing piece a lot of times is the alignment. And we need to make sure that the body's put into the right alignment, and then the right muscles are doing the balancing for us, not just some generalized muscles.
Yeah, absolutely. Yeah. Plantar fasciitis, SI joint, and pathology, impingement, functional scoliosis, right, are all things like conditions, to your point, Paul, that people come in who have sciatica are also told that they have. And, it's stuff that we can help you get the root cause too. And it's really all signs or symptoms of the same mechanism, that's just presenting in all these different areas of pain or different types of pain that we have names for. But it's all a signal that, hey, there's imbalance going on, and you got to correct it. You got to find the root cause and correct it.
Yeah. Sciatica really sucks. Any nerve pain, if you've ever had it, is like, yeah, that's the stuff that clenches your teeth, and it makes you want to, do something drastic. But there are natural remedies, and what we do is, non-invasive, and I would consider it very straightforward in terms of when we look at your alignment, and then, realign it, get the right muscles to do their job. It's pretty remarkable what the body can do to recover.
Yeah, it's always trying to heal, right? Just got to put it in a position where it can. So much to it, and like we said, it can be person dependent. So if anybody watching this is suffering from it, definitely reach out to us, and we'll be able to help create a sequence of exercises customized to your specific body, your movement patterns, because that's what needs to happen, to help it heal. And that really big thing that we do is preventative, right? So once it does heal, keep it from coming back.